Let's finish this off with two common and important questions. We'll address those who have health savings accounts, or HSAs, and then cover when you would be automatically signed up for Medicare. First, Medicare and health savings accounts do not play nice together. The IRS does not allow any HSA contributions by you nor your employer once you are on any part of Medicare. That means that even if you take Part A only and you keep working, you and your employer must stop HSA contributions. If you're past 65 when you go on Medicare, things get weird. Medicare will backdate your Part A start date to either your 65th birthday or 6 months back, whichever is closest. Let's look at 3 examples to clarify. Let's say that you sign up for Medicare on your 65th birthday. This means that your Part A will start on the first of your 65th birthday month, not back 6 months because your 65th birthday month is closer. This means that the last month you or your employer could contribute to your HSA would be the month before your 65th birthday month. The second example is if you start Medicare 2 months after your 65th birthday. Well, your Part A will backdate 6 months or your 65th birthday, whichever is closest. Since your 65th birthday is closer than 6 months back, your Part A will start on the first day of your birthday month, and your last HSA contribution would be the month before your 65th birthday. The third example is if you start Medicare 8 months past your 65th birthday, or any number of months greater than 6. So this could be years after 65. The point is that your Part A would be backdated 6 months, since that is closer than your 65th birthday month, and your last HSA contribution can be made the month prior. A lot of people want to try and cheat the system. Let's say that this last contribution month is March. They think, well, I'll just make the full year's worth of HSA contributions this month. It doesn't work like that. It is a prorated amount. In this example, with us using March, the third month, you or a combination of you and your employer can make 3/12 of the total HSA max contribution amount for that year. Now, there are approved uses for your HSA dollars and unapproved uses. The dollars are yours, and you can continue to use them for approved healthcare expenses like plan deductibles, copays, and coinsurance. You can use them to pay for Advantage Plan premiums if you have them, dental and vision premiums. However, you cannot use your HSA dollars to pay for your Medicare supplement plan premiums if you went with a Medicare supplement plan. This only adds to the cost issue that comes with supplement plans. That's the only unapproved, what I would say would seem like it would make sense to be approved, but isn't use of your HSA dollars. All right, the last topic here, and that is when Medicare is automatic. If you are taking Social Security benefits before age 65, you will automatically be signed up for both Part A and Part B of Medicare on your 65th birthday. Your card will arrive about 3 months before your 65th birthday. Now, you can opt out of Part B if you will still be covered by a company plan and don't want to pay the company plan premiums and Part B premiums. You can opt out of Part B, but this is something that you have to proactively do. If you do nothing, you will get both Part A and Part B. Okay, this next slide is the most important thing that we can convey. If you remember only one thing from this entire time that we've spent together, please remember this: 90 days. And no, I don't mean our logo specifically, although it is important. The point is to start early. Start this process 90 days before you need Medicare to begin. These are massive government programs, and they do not move quickly. The number one mistake that we see people make starting Medicare is starting the process too late. You will not be able to sign up for Parts A and B and then get your supplement plan or an Advantage plan on the last day of the month before your 65th birthday or when you need Medicare to start. It just doesn't happen that fast. Start the process early. I hinted at this a couple of times, but the second thing that we would always recommend is working with a licensed agent on these decisions. Agents are not allowed to charge you for help. It will not cost you anything to use an agent. Agents are paid by the insurance companies that offer Advantage plans, supplement plans, drug plans, dental, and vision plans. You do not pay more for these plans. You pay the exact same whether you use an agent or not, but with an agent, you have a helper to be there for the rest of your life with your Medicare decisions. If you have that person in your life and you trust them and they offer Advantage plans and supplement plans and drug plans, please use them. Even if it's not us, please use our competitors if you know and trust them. If you do not have that person in your life, we are more than happy to help. And here are your next steps. 90daysfromretirement.com has so many no-cost resources for you around Medicare, Social Security, estate planning, and long-term care. Visit our YouTube channel for even more videos with cost comparisons and deep dives into specific topics. You can always send me an email if you have questions, and now you are a Medicare expert of sorts. How does it feel? Remember that with great power comes great responsibility. Thank you for spending this time with me, and I hope you found this helpful. You can always rewatch at your own convenience or reach out to us. I appreciate you, and thank you for watching.